Hi, I'm Phaedra Kress, Executive Editor of the Aesthetic Surgery Journal, and I'm here with the well-known, world-renowned Grant Stevens. Dr. Stevens, hi, thank you for joining us.
Hi Phaedra, how you doing?
I'm well, thank you.
You having a good meeting?
I am, how about you?
Great. It's
Excellent.
great to be back at ASAP's.
Very good. And Montreal's a beautiful city, isn't it?
No kidding. It's wonderful, lovely.
Great. So I am so excited to tell you that your article is the most downloaded for the Aesthetic Surgery Journal of all articles that we published in the past year. Congratulations.
Thank you very much.
That is such a nice honor.
Thank you very much.
Do you want to tell us a little bit about your Coolsculpting article?
I'd love to. First, I'd like to thank you in the Aesthetic Journal and also thank the readers for voting us #1 with their feet, so to speak. It's quite wonderful. I'm humbled that we had the #1 article of the year.
It's well deserved.
Thank you very much. In this article, we looked at our experience with Coolsculpting over a 3-year period of time. We looked at the patients that came in to have non-surgical fat reduction in 2011, 2012, and 2013. We found some interesting things. We found out that 67% of the patients had never been in marinoplastic surgery. In other words, they'd never been patients of my office. We also found that 62% of them had never had an aesthetic surgical procedure or aesthetic medical procedure, including a facial. In addition to that, we found that 42% of them were men, which was completely revolutionary because up until now, 10% of our patients were men, and now all of a sudden it was 4 times that. 42% of these new patients coming in the door for Coolsculpting were men.
So how do you think Coolsculpting and that technique and what you've learned evolutionarily in the last few years has kind of shaped what you do in your practice and what your patients come in asking for?
Well, the interesting thing is over 40% of those patients have continued with the patients, and they are patients for life as we know them here in the marina, or there in the marina. And these patients for life come in for secondary and tertiary procedures, meaning they come in for injectables, laser hair removal, facials, and even surgery, the tertiary procedures. We're seeing many more of these patients become surgery patients. Many of the men are becoming surgery patients, and they're staying also for facials and laser hair removal, and that's why we developed Marina Manland.
So shifting gears a little bit, we've talked a little bit about non-injectables. What are you seeing in terms of surgical procedures in your practice? What's hot right now?
Well, one of the things that's hot is breast revision. A lot of women are coming in with older implants, and they want to downsize their implants, or they want the new gummy bear breast implants, or they want to lift. And they have old implants, they've gotten older, and they want to have the implants removed, exchanged for the new implants, and a simultaneous breast lift. Certainly there's a move to downsize breast implants in my practice, and women are getting rid of saline and they're getting rid of old gel breast implants.
So you live in an area where, you know, sometimes I guess it could be perceived as bigger might be better. So if people are downsizing now, what would you say in terms of breast augmentation and revision, other than what you just mentioned, what are you seeing in the practice?
Well, you know, I think that's somewhat of a media-driven myth that somehow in LA women bigger is better. It might be true in Vegas and Dallas, but I've been in practice now for 28 years, and we've been through times where bigger was better, bigger lips, bigger breasts. But I would say over the last 3 to 5 years, I'm being asked for smaller breast implants, and when women come in with previous breast implants, the majority of them ask me to go a little smaller or significantly smaller, depending. That's not to say there aren't women that want bigger, and there's no value judging intended. It's just that women seem to, as they get older, they want to downsize their breast implants because larger breasts make them look fat in their opinion. They don't want to look fat or heavy, so they want a more youthful, perky breast.
And one last question, if I could. What would you say about the Kardashian factor? How has what we've been seeing in the media sort of influenced what people come in either asking for or their expectations? Are you seeing sort of, you know, they want that A-list look?
Well, it really depends on the patient demographic. I certainly do have some people that come in and ask for the Kardashian look, but frankly, most of my patients laugh at the Kardashian look. I must say, in all honesty, my demographic is not all that amused and impressed and wants to look like Kim Kardashian. Now, having said that, however, my associate is doing an awful lot of buttocks enhancement and a lot of Brazilian butt lifts, and taking fat from other parts of their body and making their buttocks rounder and fuller and larger. You know, Phaedra, I never thought I'd live to see the day where a woman asked me for a bigger butt. I just never thought that day would happen.
But here we are.
Here we are. And so, you know, it's like fashion. The styles change, and starting with J-Lo and then Kim Kardashian, and then who knows what's next.
Dr. Stevens, thank you so much. It's been a pleasure.
Thanks for having me, Phaedra.